Good morning, everybody. Thank you so much for joining us for our coffee conversations today. Today we have Dr. Christina Wilson with us. We are so excited. She is going to be talking with us about breast cancer and body image. So such a very personable topic, but something that's so very needed. Dr. Wilson, we're excited to have you today. Go ahead and tell us about yourself, the work that you do, and what interests you in talking about this particular topic?
Absolutely. So as you said, my name is Christina Wilson. I am an assistant professor here at the University of Alabama at Birmingham School of Nursing, and I also am in the School of Medicine in the Division of Gynonc, where I treat body image and sexual health issues in patients with cancer. And I was originally brought to this topic because of the patients that I encountered. And I noticed that both breast and GYN cancer patients had a sense of change in themselves after their cancer battles, and well, during and after. And that it kind of led to a change of who they felt they were. And then I also learned in my research and training that those feelings of body image impacted their sexual health and how they felt about themselves, not only in themselves, but in intimate relationships with others. And so that's what kind of drew me in. And it was that clinical practice piece. And then afterwards, I went and got my doctorate to learn more and be able to do more research and treat patients for these issues.
Well, I'm so glad that you have an interest in it and you can educate us on something so important as this. And so speaking to that a little bit, can you kind of define what is body image and why is it such an important topic for breast cancer patients?
Absolutely. So body image there are multiple definitions of body image. I like to encompass the first type of body image as the way one feels about themselves. So not necessarily how someone else sees you or how someone else's perception of your body is, but how you internally perceive that, and how it affects who you are. And there are different types of body image, and I think we can get to that, but those different types of body image impact different areas of focus. And when you are undergoing cancer, it kind of changes the situation you're in, and you may undergo procedures and you may undergo testing or treatment or things like that that can change who you are, both internally and externally, as well as your relationships with others.
Yes, thank you so much for saying that. Body image isn't necessarily how people define you, but how you feel about yourself. Oftentimes we think about, body image, like how do I look? How do they perceive me? But a lot of that is about how we feel about ourselves and how we think we look when we feel a way. So I love that you pointed that out. I know you talked a little bit too about different body types. So can you kind of give a little bit more detail on like what are the different types of body image?
Yeah, so there are three kind of main types that we typically focus. And like I said, I'm talking about an inward perspective of how you see your body when I'm defining body image. There are different ways, like I said, that you can define it, but I define it as how one sees themselves. And so there is internal body factors, which are internal changes that may affect how you view your body. So anxiety, depression, those changes that occur within and everything. There's also external body factors, which are scarring or hair loss or a surgical removal of the breast, like a mastectomy or even a lumpectomy. And then there is the psychosocial body image or the interpersonal body image, and it's how you feel about your body when in a social or interpersonal relationship, whether that is a sexual context or even a friendship context of how you perceive your body in a social setting. So perhaps you're going to the beach with someone and wearing a bathing suit, and perhaps you're more self-conscious, which has an internal body image effect, but it also is more heightened because of a social context of being out in public. And so I typically see three major areas of body image in those three.
And so, like, in what way have you seen that it mostly affects the breast cancer patient population? Like, obviously, surgeries and different things like that. So can you give like a little bit more detail on those things?
Sure. So external body image are some of the major things that may occur to begin with when you're thinking about having a mastectomy or a lumpectomy, where you're having surgical removal of a part of your body. It can also occur from radiation, where radiation is causing skin changes and things like that. Hair loss from chemotherapy and various items like that. But as patients may go through treatment, they may also have these impacts on their body image and how they view their body based on these internal factors of, is depression occurring because of how I feel about my body? Is there anxiety going on with this? Am I anxious about losing my hair or losing a breast? Or am I, depending upon where someone is in their lifespan, a potential loss of reproductive ability? That's more of an internal type of body image, thinking about how your cancer diagnosis has played on your ability to have to reproduce. It can also have impacts on some of the other changes that you may not specifically see outwardly that have that perspective. And then, like I said, it has these interpersonal components where it can affect intimate relationships with a partner. It can affect friendships, where it's putting a strain of, I don't want anyone to see me like this because I don't see myself in the way I was. And so body image issues can not only lead to these external, I don't like the way I look about myself, but they can also lead to consequences of being socially isolating and potentially isolating people from their support systems and things like that.
Yes, and as I'm sure we all know, anybody in this particular population needs support. And unfortunately, this is just the reality of some of those things that we kind of go through, or a patient would be going through as they're navigating the different changes that are going on with their body that they can't necessarily control. So in instances where a person is getting a lumpectomy, I am tongue twisting my words, a lumpectomy, a mastectomy, and all of these other different things, what are the types of treatments that a person can, or some things that resources that might be available for somebody who is struggling with this change in their life and wanting to refocus the way that they view their body and body imagery?
Absolutely. So first, I think it's a general practice of redefining yourself and not letting the cancer itself define you, which may be easier said than done, but that's where counselors and counselors, psychologists, things like that can be very helpful. And there are exercises that you can do that have been shown to be research-based, using a mirror to help you identify the positive aspects of your body that can help you redefine your body image after undergoing a traumatic event such as breast cancer. Research also shows that yoga and types of stretching and energetic activity actually help in may help a lot more with the internal body image issues. They can help with external, but it seems to increase the endorphin levels. It helps increase your areas of serotonin and dopamine and things like that to really help you have a more positive feeling. There's also even been research showing that journaling and art therapy can help you express how you feel about yourself and allow for outward expression of the feelings that may be consuming you inside about how you look and feel on the inside and the outside and in your relationships. And so I think talking to someone, whether it be a support group of peers, which has been shown effective, to have that peer support, talking to someone one-on-one as a counselor, learning to do body exercises about like redefining who you are and going through those things, as well as trying things like yoga and journaling and art therapy to really help you kind of refocus and redefine.
Thank you for that. And I'm so glad that you were able to kind of speak to those different things that people can do, right? Because maybe the mirror doesn't work for somebody, but maybe talking to someone does, or talking to, you know, a support group might be more helpful. So thank you for pointing out those different things that might work for different people. And speaking a little to those types of issues that a person might have, like I want to talk about, I'm feeling this particular way because I have lost my hair, or I have these horrible scars, or I'm having these skin issues due to radiation. Is it common for someone to feel defined by these decisions? Like, hey, like I've made these decisions about my body. This is just a new me. Is there a period where, you know, or is it common for someone who's going through these different transitions to feel defined by what they see on the outside, or what they might feel about themselves on the inside?
Absolutely. It is not uncommon. I see a lot of patients who, both with breast and GYN cancer, who feel like their cancer has changed or defined who they are. And it is a reflective process of going through and having to reestablish these things, and reestablishing trust in yourself and trust in your body, and different things. And so it's not uncommon that patients feel this way, but it also isn't, it shouldn't be a long-term consequence that people are suffering with. There are things that we can do to try to help promote these things. And I think when you were saying different things work for different people, I mean, I'm describing some of what the major research has shown, but I have different things that patients have told me they've done. I have patients who reconstruction was appropriate. I've had patients who felt reconstruction was not appropriate. I've had patients who felt like getting a tattoo. When I was in Richmond, we had a lovely tattoo artist who would do, she did nipple tattoos, but she also did really amazing scar line tattoos. And a patient had a bilateral mastectomy and had ivy tattooed across her chest because she felt like she was growing into a new self. And she was moving past this to grow into something else. And so had that ivy that was growing or climbing and everything. And so while I'm talking about larger research perspectives, when I say yoga and journaling and art therapy and some of the body mirror work, there are individual decisions that can help you with your body image. And those are things that you need to think about on your own. And are they going to impact you? And are they going to help promote who you want to be and redefining you after this? Don't let that cancer define you. Redefine you after cancer. So I always like to say, you're not a breast cancer patient. You are a patient who had breast cancer. You are an individual who had breast cancer. You're not a statistic. You are one of many, but you are you and you're individual, and figuring out what works for you may be different than what works for the next person. And so tailoring something to you is really important.
I wish I could just bottle all of that up and just give it to people. Like you said some amazing things. And I love that you pointed that out. Like, yeah, this is what all the research says, right? But there are so many other different ways, and it's okay to explore those things. I also wanted to ask, and this is kind of, just something I thought of listening to you kind of describe those things. What if a person, they know that they feel a way about what they're going through, right? But how do they actually know, oh my goodness, I'm having issues with my body image, whether that be external, whether that be internal? How do they recognize that this is an issue?
So that can be a process. And so I think it's one of those things where if you start noticing that you're uncomfortable in a certain circumstance that you may not have been comfortable in before, or you start becoming upset at thinking about the loss, or, and in my opinion, it's one of those things where it needs to be brought up from the beginning and know that these are things that happen. And so it makes people aware from day one of diagnosis. And so it's not one of those things that you're like, I have these feelings and I don't know what these feelings are. You may have feelings about your body. You may have feelings about how your body has changed. And so that way it's not wondering if I have these issues, it's okay, now I know I have these issues. Now I'm going to talk to my my surgeon, my oncologist, my nurse practitioner, my counselor, whatever. I'm going to talk to them because I already know that these may happen. Just like we may tell you that you may have hair loss or nausea with chemo, any diagnosis, you may have feelings about your body changing you from the fact that you have cancer inside and having to either take that out with surgery or with chemo or with radiation, or if it's the hair loss or things like that, recognizing from day one, and as this is something that you may experience to help prevent patients from wondering if this is normal or if this is what I'm feeling, to help them recognize from the beginning, okay, this is now when those feelings come about, oh, I really don't know that I like this change, or how am I going to do something about this change? It's already been identified that it's something that was brought up from the beginning that patients know may occur.
And I think that's so great, like just laying it all out and just normalizing it. Like it's okay to feel a little bit differently about yourself because you're going through something you've never been through before. So I love that it is all laid out. And I know you've given so many different wonderful tips, wonderful resources that people can utilize if they do realize, like, I'm having some issues getting past this or getting through this or recognizing what it is that I'm feeling. Are there any other things that you would suggest that you have not already for individuals who might be struggling with, okay, I'm having some body image issues, I'm feeling very insecure, I don't want to go places, I don't want people to come and see me, and it, just like you said earlier, isolating themselves from the things that they do need, right? How do they go about, saying, I want to address it, but I don't know how? Because that can be a barrier for them. Like, I want to talk about it, but I don't know how or who to talk to. What are those first steps that you would recommend for those individuals?
So I'm going to give you permission right here, right now, to talk to your providers. This is your health. This is your body. This is what matters to you. So don't worry about how it makes us feel. If it's going to make us feel uncomfortable, if it's going to make us not, if we may not know the answer right away or something like that, don't worry about how we feel, because and the literature shows that both providers and patients have issues discussing this. But I want to empower you now to just say, I'm worried about my body image, or I don't like the way my body looks anymore, or something like that, to bring it to our attention. Then you have triggered the responsibility onto us as the clinician to find a resource, to find an outlet, to try to help you process through that. Because we may be able to kind of get glimpse of, is this something that's going on with the patient? But if you outwardly tell us, then it's similar to nausea. If you tell me I'm having nausea with my cancer treatment, okay, well, we're going to try to find something to address the nausea. Very similarly, I want to empower you to think about body image in the same way, or as the same type of symptom, and just bring up that one sentence quote. I'm having trouble with my body image, just like I'm having trouble with nausea, because then it starts the conversation, and it's one of those things where we all need to be good about it, and as clinicians, we need to be diligent about asking, but I also want to empower patients that it's your body, and to advocate for yourself, because that is the way that we can actually make a difference in the way you're feeling.
I love that word, advocating for yourself. Like, yes, there's such power in being your own advocate, because nobody can tell you how you feel better than you. And it's so important to tell it to the person that can, do the most, or have the most efficient way of helping you. So I love that you use that. Advocating for self is such a huge deal. Any other final thoughts that you'd like to leave our viewers and listeners with today?
I think that's my big one is, I want patients to feel empowered and feel confident in bringing up how they, anything. So I know we're talking about body image, but any type of symptom, I want you to feel empowered to talk, because like I just said, every patient's experience is different. Yes, we know these might be common things that patients with breast cancer experience, but every person's journey is different. And so I want to empower you to tell us your journey so that we can better help you.
Thank you so much, Dr. Wilson. It has been so lovely having you for our coffee conversations, and such a touchy topic as well, but you made it feel normal. So that's great. And I hope that this empowers somebody to really address it in a healthy way. And we hope that you are able to join us for another time in the future.